The Migrant Health Access Project was a project to try and increase registration for migrants with GPs across London, particularly across the Olympic boroughs. We did a DVD in 19 languages. We developed an SL pack, English for speakers of other languages, which was supported by British Council. And we also developed a network of multimedia advocates amongst 14 migrant rights activists in East London. What happened in 2004, the government changed their regulations for charging for overseas visitors, and at that time the board at NHS Newham thought that the government might change it to primary care. So they were worried about that, so they wanted to try and get the message out to migrants what the issues were, and to clarify and stop any confusion in Newham and then in the rest of East London. If people aren't registered with the GP, then what they'll do is they'll wait till they get more ill and then end up going to A&E, which then costs more money. And so what we did was we looked at the A&E figures, and we worked with urgent care centre development staff, and we looked at the unregistered patients that were going to A&E. So we were monitoring how many people were going to A&E that were unregistered patients. And we were also monitoring how many new migrants were registering with the GP. So we were using different data sources to do that. Well, we got the understanding of how to register with the GP amongst GPs and reception staff. We also got discussion going amongst migrants themselves and migrant rights community organisations, and passing out DVDs across the whole of East London. We've put out several thousand DVDs across East London, and getting people to talk about what was about registering with GPs and how to go about doing it. So I used the social model experience to shape any plans. So plan, deliver, study and assess. We started to look at what social barriers were, and then look at how those solutions could be found, and then working in partnership with migrant rights communities, working with the Department of Health and statutory partners, and being at the table with them as equals. And I think the Department of Health learned from that and have started to work more closely with the migrant rights community and with the community in general, and I think that's been a great big plus from the project.